the name badge, scan the room. And before we begin, I am going to state that I am working at below waste level, which in a hospital setting you would not do since it's considered contaminated. But, you know, we're doing it today. All right, so now I'm going to get started. Knock, knock. Hey, my name is Ebony. I'm a student nurse at the University of South Alabama. I will be taking care of you today. So the first thing I'm going to do is I'm going to check the order form and the hospital policy. Okay, and now I will perform hand hygiene. And then I will identify the patient using two identifiers. The first identifier is going to be the name, Jaguar Jones, date of birth, 8/25/1963, 8/25/1963. I also see here that you have an allergy to penicillin. Any other allergies that I should know of? All right, well, since you are Mrs. Jaguar Jones, I will explain the procedure to you. So today we will be inserting an indwelling urinary catheter. 3 reasons a person might need a urinary catheter is for acute ventilator-dependent respiratory failure, acute worsening of mental status, or palliative or end-of-life care. Sounds good? Okay. So now what I'm going to do is I am going to close your curtain for privacy, and then I will gather my equipment, okay? Gathering my equipment, I will don my goggles, position the trash can where it is needed, perform hand hygiene. Now I am going to raise your bed to a working level for me, lower your side rail, and then position you in dorsal recumbent. So dorsal recumbent is basically going to be you laying down with your legs up and spread apart. And they would usually be up like this, but since, it might stay. And then we would do the same to this side. There you go. All right. So now I would put on clean gloves, and I will clean the perineal area with warm water and soap just to get rid of any bacteria before we begin moving forward. So now I will grab my catheter tray, remove it from its bagging. Position right there, and then we can also make this catheter bag into a little trash can if needed, but I don't need it today. Okay, so now I will start by opening up my catheter tray, and I will start by having the first flap opened away from me. Okay. Okay, and then what I'm going to do now, I'm going to don sterile gloves. So, all right, now that I have my sterile gloves, I remove it from its packaging, and I would throw it away. Open it. Okay. I'll grab the first glove. And then, okay. Okay, and then I'm gonna crease it just to make sure I got it where I need it. Only touching glove to glove. So now I will grab my sterile field. Okay. I will note that there's the shiny side, and we're gonna be going shiny side down. lay this down under there, and we will note this is the 1-inch border right there. Lay this back. Okay. Now, we do have another field which you could put over the perineal area, but we're not going to be using that today. And next thing I would do is I would remove the inner tray and place it on my sterile field. And then I would grab my basal iodine and put it on my cotton balls. So I'll open it up, put it on the cotton balls. And then I would have my lubricant. I'll put my lubricant on the tray. All right. And next thing I'm going to do now is I will now grab my urinary catheter and I would connect my syringe. So we're gonna open up the top of it. Connect it to the syringe, to the catheter. And at this point, we are going to remove this from there. Throw that paper away. And we are going to lubricate the end of this catheter 1 to 2 inches for women, and then 5 to 7 for men. Okay. And then you just sit it in the lubricant. So now what we're gonna do is, we're using my non-dominant hand, I will spread the labia. And I will begin to clean the perineal area, starting furthest away from me. The other outer side. And then the inner. Okay. And now what we're going to do is we are going to begin to insert the catheter into the patient. So you would need to inform the patient that you're about to begin the procedure. So, hey, Mrs. Jones, I'm about to insert the catheter. I would like for you to take a deep breath in for me and then exhale. And once that happens, you will insert the catheter while they're exhaling. And then you will stop once urine is met. And then once urine is met, you will go in another 1 to 2 inches, but make sure you do not touch the perineal area with your clean glove. After that, you would grab the catheter with your non-dominant hand to keep it in place, and then you would inflate the balloon. Okay. Now after that is inflated, you will remove it. You can set that aside. And then you would tug on the catheter until resistance is met. Once resistance is met, you will go in another 1 to 2 inches. And then you would grab your stack lock to secure the catheter in position. So I would grab my stack lock. Then we would usually have it open it up. Okay. And then you would open it. And then this is how you put it into the stack lock, and you will close it like that, and you will hook it onto the inner thigh, and then to remove it, you just press this, and then it removes. But this will still be on there. This just removes the catheter. So you have that put on there, and then at this point, you are going to grab your urine bag and make sure there's not a lot of big loops in the tube, just so urine doesn't get stuck anywhere. And then you would hook the urine bag onto the bed frame and not the bed rail. for urine flow. So you would hook it down there. Okay, and so now at this point we are going to be demonstrating how to collect a urine sample from the urine bag. So the only time you would collect urine from the urine bag is when you first have put in the catheter. So in order to do that position, so you will need a granulated cylinder. You need your granulated cylinder, your container for collection, and you would have the top opened, and you remove this tubing that's up here like this. Okay, and then on this tubing it has it where it's stopped, so urine will not flow out if you pull it like this. And then once you're ready, you would push this over and it will allow urine to flow in. Now you would fill it up until you meet your desired amount, and then you would close it back up, put the tubing back into the bag, put the top back on here, and then you will fill it out. Now, if you were trying to collect urine from up here in the tube, you would do that after, if it's not the initial time of the catheter been put on. So any other time after that, you would collect it from up here. And you can do that by, first you're gonna stop the urine flow to the bag. Okay. And then we're gonna get an alcohol white pad, and we are going to clean this tubing that's right there. So you got your white pad, you would clean that, discard it, and then you would get a syringe, insert it into the tubing, and then just pull back. Once it's in, you would just pull back. And then you would put all of that into here. Then you would close it up and document. So now that that part of it is over, of me showing you how to collect urine specimen, after this portion is done, you would usually clean up your area, throw all of this away, remove your gloves using proper procedure, so glove to glove, skin to skin, and then just moving everything out the way. So after you've done that, I'm going to wash my hands. I am going to lower the patient's bed, raise their side rail, and then position them comfortably in the bed. And then I am going to go document. So I am going to document the amount, the color, the size, and the consistency of the urine. And then I will also document how to clean or cleaning the peritoneal area with the catheter, and then documenting that you would remove a catheter immediately when medically advised. So next part of this is going to be us demonstrating how to discontinue a catheter. So at this point, you would come in, introduce yourself obviously again, and then explain that you're removing the catheter from the patient. And then I will put on some clean gloves. Okay. Okay. So what you would do is you would unhook the catheter from the lock pad, but keeping the lock pad on the leg. So you unhook it, and then you would unhook it, and then with your syringe, after you unhooked it, you would grab your syringe and you would pull it back 10 milliliters and then half a milliliter. And then you would insert it into the catheter and then just let gravity fill it back up. Okay, and after it is finished, you would unhook that, set it aside, and then you will remove the catheter from the perineal area. Okay, and then you would, after this step, you would usually perform perineal care as you did before you inserted the catheter. And then you would clean up your mess, grab all of this, put it away. Take off your gloves, perform hand hygiene, and then I would document. So at this part of documentation, I am going to document the amount, color, odor, and consistency of urine. I will also document how the patient tolerated the procedure. I will document patient teaching of UTI symptoms, which could include pain while urinating frequency, or lower back pain. And then we will also state that we will come in and check on the patient and see if they've had a void within 4 to 6 hours. If they have not, we will palpate the bladder or we will get a bladder scan.